absolutely.
So you say it's not actually defunding Planned Parenthood, but in fact, that's what it feels like, and that's the message that's gone out, and it is important for this group in particular, highly engaged, informed people who want to know what can we do, though, to ensure that the population you're serving will continue to be served.
Well, obviously call your senator and call your member of Congress. This is an incredibly important and influential group, and I think that people have been asking this a lot. I think it's time, and again, I heard some panels this morning that were really important about talking about people understanding our privilege and what our obligations are. And so I would just say, as we try to unpack other big issues that we have to deal with more in this country, like the issue of racism, it's not on people of color to undo racism. That's our work. And I would say the same about women. Shouldn't just be on women to protect women's rights and to undo historic and now, I think, ongoing sexism and patriarchy. That's on all of us, my friends. That's on everybody in this room. One other thing that's really important because, and I like that Larry was talking about the fact that there's all kinds of things actually that we're doing better, and because it's very easy to just now be completely, sort of beaten down by having to just protect things that we have. Over the last few years, and particularly because the Affordable Care Act began to we got parity for women in so many areas. I mean, there was no more gender rating, so that women didn't have to pay more for health insurance than men, which historically we've had to. Women couldn't be denied coverage anymore because they'd had breast cancer or had survived sexual assault or had had a cesarean section, all the reasons that women had been prevented access. And after a long, hard fight, we got birth control covered for all women that were in insurance plans at no copay. 55 million women today in America, before this bill passes, have access to no-cost birth control. And that's an incredible success story.
It certainly is.
And it's funny because some folks in this administration would say that, well, there's no cost issue, birth control isn't a cost issue. Well, that's only if you've never had to use it. In fact, my favorite statistic on this is, for the average woman in America that wants to get pregnant, she spends 5 years getting pregnant, having children, and she spends an average of 30 years trying not to get pregnant. So just wrap your brain around that.
I want to remember that.
It's important, but I think the important thing here, again, is it's not just about statistics. It's that we actually now are, today, at a historic all-time low for teenage pregnancy in the United States of America, and that is incredibly exciting. Related to that, we're now at a 30-year low for unintended pregnancy, and we're actually at the lowest abortion rate since Roe versus Wade was decided, okay? These are important healthcare outcomes that take a long time to achieve, and they don't happen on their own. And so the truth is, we know what works. What works is getting women and all people access to affordable health care, investing in prevention, taking away barriers to access. And so it is incredibly heartbreaking and frankly makes me really angry that we would now go back on all of that progress that we fought so hard to achieve for women in this country.